Good day, viewers, and welcome to the DDM Health News Update. Under the program, Your Health, Your Wealth. Pope Francis has been admitted to Rome's Gemelli Hospital for medical evaluation and treatment of ongoing bronchitis, the Vatican announced on Friday. The 88-year-old pontiff, who has experienced noticeable breathlessness in recent days, was hospitalized following his morning engagement. Reports indicate that he has increasingly relied on aids to deliver his speeches due to his respiratory discomfort. According to Vatican sources, the hospitalization allows for necessary diagnostic tests and continued treatment in a controlled medical environment. Pope Francis, who underwent a partial lung removal in his youth, has faced recurrent respiratory issues, with his latest bout of bronchitis affecting his ability to maintain his usual schedule. This marks his second hospitalization for bronchitis in recent years, following a 3-night stay in March 2023 when he was treated with antibiotics. In December of the same year, a similar condition forced him to cancel his attendance at the COP28 Climate Summit in Dubai. Beyond respiratory concerns, the Holy Father has endured a series of health challenges, including chronic knee pain, hip pain, an inflamed column, and hernia surgery. Despite these setbacks, Pope Francis has continued to fulfill his pastoral duties, albeit with increasing adjustment to accommodate his well-being. The Vatican has yet to provide further details to the expected duration of his hospitalization, but officials remain optimistic about his recovery. Next, in a conditioned demonstration of his dedication to national development through education, healthcare, and empowerment, former Anambra State Governor and Labour Party presidential candidate Peter Obi has pledged unwavering support for the advancement of Nigerian healthcare sector. During a recent visit to the Mater Misericordia College of Nursing Sciences in Afikpo, Ebonyi State, Obi recommended the institution for its enduring contribution to the medical field. Established in 1946, the college remains one of Nigeria's foremost healthcare training institutions, with its schools of nursing and midwifery founded in 1952 and 1953 respectively, producing thousands of professionals who continue to make significant impact in healthcare. Acknowledging the school's ongoing infrastructural developments and the enrollment of approximately 1,000 students, Obi affirmed his commitment to strengthening healthcare education in Nigeria. As a gesture of support, he made an initial donation of 10 million naira to facilitate the training of healthcare professionals. Speaking to the students, he underscored healthcare as a critical pillar of human development, emphasizing the global demand for well-trained medical practitioners. He encouraged them to remain steadfast in their studies, highlighting the essential role that nurses and other healthcare professionals play in national progress and global health systems. Obi further expressed profound appreciation for the institution staff for their dedication to shaping future healthcare leaders. He also commended the Ebonyi State government for its collaborative efforts with the institution, noting that such partnerships are instrumental in fostering sustainable healthcare development in Nigeria. With this commitment, Peter Obi once again reinforced his vision for the nation where education and healthcare are prioritized as catalysts for socio-economic transformation. Let's move to Kwara State. In a significant stride towards healthcare revitalization, the Kwara State government has awarded contracts worth 5 billion naira for the comprehensive upgrade of 70 primary health centers, PHCs, across the state's 3 senatorial districts. The Executive Secretary of the Kwara State Primary Health Care Development Agency, Dr. Nusirat Elelu, made this announcement during a contract signing event in Ilorin. She highlighted that the extensive intervention, supported by the World Bank-backed Immunization Plus and Malaria Progress by accelerating progress and transforming impacts, would encompass infrastructural enhancements, solar power installations, provision of staff quarters, potable water supply, and the development of cutting-edge medical equipment. Dr. Ilulo emphasized that this initiative is designed to elevate the quality of primary healthcare delivery across Kwara, ensuring that PHCs are adequately equipped to serve as the critical first point of contact within the national health system. She urged contractors to uphold the highest standard of execution, warning that any contractor found defaulting would face immediate contract termination. Reaffirming the government's commitment to strengthening the healthcare sector, she noted that this initiative builds up previous efforts which have seen the successful renovation of 53 PHCs, with an additional 9 currently under refurbishment. She further disclosed that the government recently recruited 105 PHC personnel, including doctors, to reinforce healthcare service delivery across the state. The Impact Program Manager, Michael Ogutoye, underscores the urgency of timely execution, stating that the contracted works must be completed within 3 months. He cautioned against delay, stressing that the project is part of a broader effort to reduce maternal and child mortality rates while improving healthcare accessibility for all residents of the state. Beyond infrastructure, the Impact Initiative aims to enhance national health monitoring and evaluation systems, drive demand for quality healthcare services, and improve overall service delivery standards. The primary beneficiaries of this ambitious project remain women and children under 5, ensuring a healthier and more resilient future for the state's more vulnerable populations. With this bold initiative, the Kwara State government continues to demonstrate its unwavering commitment to advancing healthcare and strengthening the foundation of primary health service delivery for its citizens. In a sweeping enforcement operation, the National Agency for Food and Drug Administration and Control, NAFDAC, has uncovered and seized over 10 trucks, each carrying a 40-foot container filled with counterfeit, expired, and false-filled pharmaceuticals at Oborgu Bridgehead Market in Onitsha, Anambra State. This large-scale intervention, which commenced earlier this week, has led to the discovery of billions of naira worth of substandard and repackaged drugs, exposing a sophisticated network involved in the illegal trade of false-filled medicines. According to NAFDAC, the market has become a hub of revalidating and reselling expired drugs under false pretense, endangering the health of countless Nigerians. Speaking to the press on the 5th day of the operation, the director of NAFDAC Southeast Zone, Dr. Martins Iluyomade, revealed that the confiscated drugs, many falsely labeled with counterfeit NAFDAC approval seals, were detected using advanced scanning and verification technology. The seized items include expired, banned, and defective medications, all of which pose severe health risks, including death and permanent disability. Dr. Iluyomade further disclosed that several drug merchants were caught using specialized machines to reband, repackage, and manipulate the expired drugs of medicine, effectively deceiving unsuspecting consumers. These machines, along with fraudulent packaging materials, were confiscated during the raid. The operation, backed by extensive intelligence gathering and collaboration with security agencies and market stakeholders, has also resulted in multiple arrests. Notably, some individuals attempted to obstruct the exercise by offering bribes totaling of 135 million naira, an offer that NAFDAC operatively categorically rejected. This decisive crackdown is part of the federal government's intensified efforts to dismantle the distribution network of counterfeit pharmaceuticals across the country. In light of the magnitude of these violations, NAFDAC is currently reviewing its regulatory framework to enforce stricter penalties, including life imprisonment or the death penalty for those found guilty of manufacturing and distributing harmful drugs. Dr. Iluyomade described the situation as alarming, stating that over 90% of the shops inspected in the market were engaged in the sale of fake and substandard medicines. However, he noted that a small percentage of traders, less than 10%, were found to be compliant and have now been designated as NAFDAC ambassadors in the fight against counterfeit drugs. One such trader, Chukwudi Ikem, expressed his gratitude acknowledging that he had this raid taking place years ago, he might not have passed inspection due to his past involvement in illicit drug sales. My conscience troubled me and I decided to change my ways. Today I am relieved that my shop has been given a clean bill of health, he stated. As NAFDAC intensifies its enforcement actions, the agency has reaffirmed its unwavering commitment to protecting public health and ensuring that only genuine and safe pharmaceutical remains in circulation. The seized counterfeit drugs are currently being transported to NAFDAC control facility for further analysis and destruction. Now, renowned consumer scientist Bukade Adesina from Paudi University, Nigeria, has underscored the urgent need to integrate nutrition and food safety education into the country's basic school curricula. His call to action is clear: fostering lifelong habits of healthy eating and safe food handling from an early age will significantly enhance public health outcomes. Foodborne illnesses remain a silent but deadly crisis, claiming no fewer than 200,000 lives annually in Nigeria, according to the World Health Organization. Factors such as unsafe food handling, poor storage system, and contamination from harmful substances like aflatoxins, commonly found in staple foods like maize and granules, pose severe health risks. These issues are further exacerbated by insufficient regulation of food imports. Adesina stresses that a lack of proper education is a major barrier to improving food safety and nutrition in the country. Many Nigerians, he knows, remain unaware of the nutritional value of foods, safe preparation methods, and proper storage techniques, critical knowledge that could prevent food contamination and safeguard public health. Without widespread education, efforts to address these challenges will remain ineffective. Beyond education, Adesina advocates for stronger regulatory enforcement in the food sector. He urges agencies like NAFDAC and other relevant bodies to enforce stricter food safety measures, aligning Nigerian standards with international regulations to enhance food security and bolster the nation's competitiveness in the global market. To further combat this crisis, he calls for targeted public awareness campaign, leveraging community leaders, influencers, and public figures to disseminate culturally relevant message to food safety and nutrition. These campaigns, he believes, can bridge the knowledge gap and drive meaningful change. The role of smallholder farmers in ensuring food safety cannot be overlooked. Adesina recommends training farmers on safe agricultural practices and equipping them with improved storage technologies to reduce food contamination risk. He highlights the importance of investing in fortified and biofortified crops, such as orange-fleshed sweet potatoes, to enhance the nutritional value of food while making essential nutrients more accessible to vulnerable populations. The urgency of this issue cannot be overstated. To safeguard public health and strengthen Nigeria's food security, education, regulation, and community engagement must work hand in hand. By embedding food safety education into school curricula, enforcing stricter safety measures, and empowering farmers, Nigeria can take a decisive step towards a healthier future. Well, that is all we have for you for today. Stay informed, stay safe, and always remember, food safety is everyone's responsibility. Food safety is everyone's responsibility. Your health is your wealth. Don't forget to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. I am Nenye Michael Nezine. Until next time, take care.